Hi everyone, I'm Dr. Angela Mackey, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. Twice per month, I host this show where we discuss pediatric health topics with top experts from the Mayo Clinic Children's Center in Rochester, Minnesota. If you're joining us for the first time, we want to hear from you. Please post your questions in the comment section below about today's topic, which is common infections in children. We will be discussing things such as colds, respiratory infections, and when to be concerned if it could be something more. We are eager to answer your questions about other infections in children as well, so please send them in. My guest expert today is Dr. Thomas Boyce. Dr. Boyce is a pediatric infectious disease specialist and immunologist at the Mayo Clinic Children's Center. Dr. Boyce is an associate professor of pediatrics. He treats patients with serious infections and immune disorders in both the clinic and the hospital setting, and we're very thankful that he's here to join us today. Dr. Boyce, thanks for coming on the show.
My pleasure.
So, before we start talking about infections, I think we really need to understand how the immune system works, because our body is constantly being bombarded with bacteria and viruses and even other things that could make us sick. So what do we have going on in our body that helps us stay healthy and not sick all the time, right?
Right.
Yeah.
The immune system is really everything that your body uses both to prevent you from getting an infection and to help you clear an infection once you've got one. Consists of things that circulate in the blood like antibodies, as well as cells like T cells and B cells. One of the key aspects of the immune system is called immune memory. And immune memory is what enables you to remember a germ or something that resembles the germ from the past, so that the next time you're exposed to it, you're able to respond much more quickly.
And we use that immune memory system when we're doing vaccinations, right? And so that's how the body can recognize something that they would potentially be exposed to later, right?
It's exactly right.
Okay.
Immune memory is really the basis for all vaccines.
Okay. So cold and flu season is coming up soon. And when I say flu, I mean influenza. And it's the dreaded time of year for parents where the nose is constantly running and they're missing school and stuff. How long does a typical cold, or in medical terms we call them upper respiratory tract infections, how
Sure.
long do they typically last? And do those symptoms coincide with kind of certain times during their illness?
Yeah, the duration of a cold depends a little bit on what virus is causing it, but for the most part, it's pretty typical. And young children who are experiencing that viral infection for the first time, they tend to have a longer duration of illness, more like 10 to 14 days. Older children and adults, if they get a cold, they're usually over it by 5 to 7 days.
Okay. And like earlier in the cold, are they more likely to have a fever, or is it happen at a different time during that cold symptoms?
Yeah, that's a good point. Early on with a cold, there's usually a little bit of a low-grade fever. Most cold viruses don't cause a real high fever. But if the child is recovering from the cold and has not had a fever for a few days and then develops a fever, that's worrisome for a secondary bacterial infection like an ear infection or a sinus infection.
And you made the point earlier that colds or upper respiratory tract infections are caused by viruses. And I think it's a big thing, because as parents, we want something to give them to make them feel better. But what can we use to treat the cold symptoms with? We don't like to see our kids suffer, right?
Yeah. Well, people have tried a lot of things to make colds better, especially in kids, because we hate to have little kids suffer. But I say really just lots and lots of TLC. And the bad news is that nothing else works, and the good news is TLC always works. So.
Absolutely. So you said later in the course of the illness, if they get a fever, maybe after they initially had a fever and it went away, that would be a reason to bring them in. What are some other reasons that you would tell a family that they would need to do more than just TLC? They need to bring them in to see their medical provider.
So the main thing is concern for a secondary bacterial infection. About 10% of colds in kids are complicated by either an ear infection or a sinus infection. So if they have a new fever after having not had a fever, if they have a new cough, if they have an earache, those kind of things. Really anything that the parent feels is out of the ordinary, they can at least call, if not bring them in to have it checked out.
So in young kids, we often tend to see that they haven't been exposed to these viruses in the past, and they may become sick more often, especially kids in daycare. What's an average number of upper respiratory infections that kids may experience?
It does depend on whether they're in daycare or not. So kids who are not in daycare have, on average, about 4 to 5 colds per year. Kids who are in daycare, and these are kids, 1 to 5 years of age, kids who are in daycare have, on average, about 7 to 8 colds per year. And when you think that most of these colds are concentrated between September and April, that's about 1 cold a month. And of course, some kids have even more than that, and some have less.
Right. A question I hear all the time in practice, and sometimes I will just prophylactically say to parents that I'll say those numbers, how many colds there are, but the fact that doesn't necessarily mean there's something wrong with your child's immune system. Would you agree with that?
Right. I mean, the thing about colds is that everybody gets them, and young kids especially get them frequently. And if that's the only concern, it's rarely a sign of an immune system problem.
Right.
Just because it's usually something more like recurrent bacterial infections or something like that.
Okay. What about when can kids go back to school? Because if the symptoms are lasting 7 to 10 days and they're having 5 or more colds a year, that's a lot of missed days of school.
Yeah.
What's realistic for when they can go back to school, and when should they stay home?
Yeah. If you look at the guidelines, the recommendations, say, by the Red Book, the common cold is not an exclusion criteria for school or daycare. And that kind of makes sense when you think about it. I mean, if the cold was an exclusion for daycare, all the daycares would be shut down during the wintertime. They'd be empty. So you really can send your child to school if they have a cold. Certainly if they have a fever probably greater than 101, probably keep them home. Or if the child's symptoms are keeping them from being able to participate in school or daycare activities, then we usually say, go ahead and keep them at home.
Is there anything parents can do to prevent recurrent colds or prevent their kid from getting sick at daycare or at school? Anything that's really been shown to help? Because there's a lot of things out there in the market that people can buy or that are targeted towards families.
Yeah. I mean, good hand washing is really good, but it only goes so far. You're still going to get exposed to things. But hand sanitizer, soap and water, staying away from people that are sick. The biggest thing, of course, is immunizations. So having we don't have any immunizations for the common cold.
Right.
But as far as keeping your child healthy and being able to boost somebody's immune system. There's a lot of things on the market about boosting your immune system.
Right.
And really the only thing I know how to boost somebody's immune system is to vaccinate them. So, make sure your kids' immunizations are up to date, protects against 15, 16 different diseases, which is awesome.
When we talk about treating the symptoms of a cold, there's a lot of the over-the-counter medications. So you just talked about boosting immune system stuff, but there's a lot of cold and cough over-the-counter medications, and we really try to be cautious and caution parents about using these safely and appropriately. Is there an age which you would recommend these or not recommend these?
I don't necessarily recommend them at all in kids. I think what you're getting with the cough and cold medications, either the decongestants or the antihistamines, is you're getting the side effects, and they really have not been shown in the pediatric population to help. So some people do use a cutoff of age 2 or something like that, but certainly I would definitely not use them prior to that. But really, personally, I would say if they have a fever, you can obviously give them a fever-reducing medicine like Tylenol or Motrin. Otherwise, it really is TLC.
Absolutely. One thing we recommend for cough is honey, actually. And so we don't want kids less than a year using honey, but kids over a year, it's actually been shown to be more helpful at that cough suppressing than the over-the-counter cough medications are in young children.
Yeah.
So
and inexpensive too.
Inexpensive, and you can't overdose on honey. So
Right.
so I think that is definitely something I recommend to my families. The other thing is with those medications is you really want to be sure that if they have Tylenol or ibuprofen in them, that they're not giving an additional Tylenol and ibuprofen, because there's always that risk for overdose and stuff. And that's also one of the reasons why a lot of our national organizations say we don't want kids to be using them in this age group because there's so much risk for overdose.
That's a good point.
Yeah. What about, you said so many infections, right, that kids get exposed to. So kind of going back to that, is this going to be harmful to their immune system to have so many different infections? Is this going to put them at risk for future problems in life?
No, not at all. In fact, if you look at kids in kindergarten, those who were in daycare before they went to kindergarten have fewer infections than those kids who just show up on the first day of kindergarten without having been around a bunch of kids. So, and again, it's not that those kids' immune system is stronger. They've just gotten some exposures out of the way, and maybe at an age when they were a little younger and a little bit more bothersome to have those infections. But it doesn't hurt their immune system to have those infections.
I think that's a reassuring thing for parents to hear too, because they're always worrying too about daycare. Is it the right thing? And it's a good thing for their children, and it's fine for them to be exposed, right?
Yep.
Okay. So influenza season is going to be kicking off pretty soon in the United States, and we are starting to kick off our immunization program for influenza here at Mayo. One of the things that is most important for influenza prevention is the vaccine program, and we've started in Rochester vaccinating kids for influenza in the school district.
Right.
So why is it so important for kids to get their immunizations and everyone to get their influenza vaccines?
Yeah, influenza is important to be vaccinated against because it's a potentially much more serious illness than the common cold that we've been talking about. Every year in the U.S., a couple hundred children die of influenza, and those are preventable deaths. So really important to get vaccinated. Vaccinating children also protects other people in the population, the elderly. There's something called herd immunity, which is if so many people get vaccinated, they prevent spread to the rest of the population. So, and having a school-based vaccine program like we do in Rochester is really great because we get a fairly high percentage of our school-age kids vaccinated.
Yeah, it is. I think it's actually decreased the number of missed days from school that they've seen since they've implemented the program. So that's a benefit for families too. That means missed days from work. So you mentioned the number of influenza-related deaths that we see every year, and some of those deaths are actually in healthy children and are not necessarily in children with underlying medical conditions. And I think that's a misconception that parents have is, I have a healthy child, they'll be fine with, they don't need the influenza vaccine.
If I remember the data right, I think it's about a third of those deaths were in completely healthy children.
Wow, that's really terrifying as a mother. So my kids get their flu vaccines on the very first day they can get them. Does one other kind of feedback that people often say is, well, it doesn't work anyway. What's the point of getting it? Because some years there's good match to what is the circulating virus in the community, and some years there's not. What's the average protection offered by the influenza vaccine?
Yeah, it's about 60 to 80% on average. Some years it's less than that. We had a couple of years ago, we had a strain circulating that was not in the vaccine, and it was pretty dismal, more like 25 or 30%. But in general, it's more like 60 to 80%, and just really depends on what's circulating and what's in the vaccine.
Okay. They have to predict the circulating strains probably significant time in advance. How often do they determine which strains are going to go in that vaccine? Is it like a couple months before? Or is it even a year or so? It's
the previous spring.
Okay.
So by April, maybe as late as May, they have to know what's going to be in that vaccine for the following fall, because the vaccine virus has to be grown in eggs. Now, there are some strains of vaccine or some brands of vaccine that use cell-based technology and are not grown in eggs, and those have a shorter turnaround time. And my guess is that 15, 20 years from now, all the vaccines will be that way, and there'll be a shorter period. But for right now, it's 4 or 5 months.
Okay, that's a significant turnaround.
Yeah.
We've also had a change in what we're able to offer for different vaccine options and delivery mechanisms. So the FluMist was our intranasal flu vaccine that we had, which was a live vaccine, but that's not being offered anymore. Why is that?
FluMist was a great vaccine. I think it was nice for kids who didn't want to have a shot, and the first 10 or 12 years that we had it, it worked actually in little kids better than the inactivated, the flu shot vaccine. But starting a few years ago, they noticed that the FluMist vaccine was not effective against one of the major strains of influenza called H1N1. It was the pandemic strain in 2009. So it's not available. It's not recommended by CDC, and hopefully the vaccine company that makes it is working on it, and hopefully by next year it'll be available again.
Okay. Are there any other ways to deliver vaccines on future horizons that maybe aren't as painful for injections, because that's something kids worry about and parents.
Yes, there's a vaccine that's just being started to be studied by a different manufacturer, and it's a patch. You put it on the back of your hand like a Band-Aid and leave it there 20 minutes, and the influenza vaccine components are absorbed into the skin. And early studies show that it is immunogenic, but it's at least 5 or 10 years away.
It's a long ways out. Okay.
Yeah.
Well, it's exciting that they're trying to develop new ways to deliver the vaccine. I'm just going to take a little pause here for a second. If you're just joining us for the first time, we are talking about common infections in children and when to be worried that it could be something more. And we actually have a question from the audience coming in. And this parent asks, many times kids are exposed to different viruses. And how can you be sure it's viral and not a bacterial infection? And then why do some viral infections end up with a secondary bacterial component?
Okay, those are good questions.
Yeah.
It can be very hard to tell if somebody is having a viral infection or a bacterial infection, and I think a lot of times, that's physicians, if they don't know what it is, they say it's just a virus. But it's very hard to know. Typically, if we think it's common cold syndrome with low-grade fever or no fever, a runny nose, scratchy throat, we can say, well, that's probably a virus because we know that the causes of the common cold are all viral. But after that, it gets very gray, and it can be very hard to know whether somebody has a bacterial or a viral infection. Sometimes, obviously if we look in the ear and the ear is infected, we say, okay, that's a bacterial infection.
Right.
But it can be hard to know.
Yeah, and even some of those ear infections can be viral too. And so sometimes it helps, to look at the age of the child and their symptoms and stuff. So I think it's a case-by-case kind of approach, right?
Yeah, it really is.
Lots of detective clues that the physician is looking for, and sometimes having to get labs and x-rays and stuff. But even then, the x-rays can be kind of misleading. So
yeah, I mean, for example, the x-ray, there's a classic viral pneumonia x-ray and a classic bacterial pneumonia x-ray, but not every patient has the classic features. So it can be challenging.
Yeah, definitely. In medicine, we say sometimes patients don't follow the book, or they don't follow the rules. So somebody's always going to fall outside those parameters. Let's kind of go back to talking about influenza now. So people sometimes confuse, they'll say I have the flu, and they're talking about vomiting and diarrhea versus influenza. So what are the common symptoms of influenza?
Common symptoms of influenza depend a little bit on the age of the patient. Young children can sometimes just have high fever, and that's all. But in older children and adults, the typical classic symptoms are sudden onset of high fever, headache, muscle aches, and chills. And then usually there's some cough or sore throat involved as well.
And young kids, they can sometimes vomit with influenza too. It's not always present, right? But sometimes they may.
Yeah, little kids tend to vomit whenever they have
any
kind of infection, other than maybe a cold. But any kind of serious infection, kids tend to vomit. So we have to be careful that we don't assume that it's a GI process going on.
Yeah, it's any parent of a young child will tell you they vomit a lot.
Yeah,
absolutely. So when it comes to treatment of influenza, do they need medications? Do they need antivirals, or how do you determine that?
Yeah, we have kind of a limited supply of antivirals available in this country and in every country, and so we have to ration it based on who's going to benefit the most from the antivirals. And we do that based on saying if you're in a high-risk category, and there's a long list of risk factors that put you in the high-risk category, but young age, less than 2, greater than 65, and then any kind of really underlying medical condition, heart disease, lung disease, etc. Those patients, if they get diagnosed with influenza, we treat them with Tamiflu. And then the other group would be anybody who's sick enough with influenza to need to be hospitalized. They should be treated as well.
Absolutely. What can parents do for their kid if they don't have those risk factors where they wouldn't qualify? What would you recommend for their treatment?
Yeah, otherwise the treatment is pretty similar to what you would do for a common cold, although they're usually more febrile, so more likely to need antipyretics, Tylenol or Motrin, and just usually kids and adults with influenza really feel pretty crummy. They don't really want to do much, so just let them hang out in bed or on the couch. That's pretty much it.
So
Plenty of fluids.
Right, plenty of fluids. They're watching them at home. And because their kid is maybe a healthy kid, right? When do they need to come in? What would be some signs that would make us more concerned? Because we do, like we mentioned, there's healthy kids that can get very sick from influenza.
There are. So if and the other thing about influenza is that secondary bacterial infections are common with it, even more common than they are with the common cold. So to me, the big thing is if the child was starting to get better, maybe they're 3 or 4 days into it and their fever is starting to go down, and then they develop a new high fever again, they should be seen because they could have a secondary bacterial pneumonia. Or if the child just isn't really acting well, if they have difficulty breathing, if they're not, getting better, if it's, 6-7 days in and they're still not getting better, they should be seen. Again, if there's any question as to, how they're doing, call the nurse line and they can really direct the parents.
Absolutely. When can you go back to work? When can you go back to school if your child has influenza? And I should say you suspect having influenza because we don't always test for influenza as well.
Right. We generally only test high-risk patients and hospitalized patients because it usually doesn't make a difference in the other populations. But during the middle of influenza season, if they've got, the symptoms that we talked about, high fever and real achy, they probably do have influenza. That's about 80% sensitive.
Okay.
As far as when they can go back, the guidelines say that they should be without fever for 24 hours in the absence of any antipyretic like Tylenol or Motrin.
Okay. So they can go back to school even if they're maybe not 100%. Same with the cold symptoms we talked about.
Yeah, it's kind of like, can they still do the activities of school or daycare, work reasonably well? If they're not able to participate, it's probably too soon for them to go back.
So if they can go back to school and they're not having fever, does that mean they're no longer infectious, that they're not shedding virus?
Yeah, kids shed flu virus longer than adults do. So you do want to make sure that they're definitely, I think they say at least 7 days from the onset of illness and 24 hours without fever.
Okay. Can the flu virus is transmitted through respiratory secretions, right?
Correct.
Can it live on, inanimate objects for a long time or not?
It's not easily transmitted that way. So it's mostly transmitted person to person.
Okay.
Yeah.
So good hand washing, good cough hygiene for kids, which is something that every parent is trying to teach their child how to effectively cover their cough, right?
Yeah.
Absolutely. Okay, so we talked about common infections in kids, but in the back of a lot of parents' minds sometimes is this something more? My kid seems sick all the time. When should parents start to worry that something might be wrong with their child's immune system? Are there classic signs?
That's difficult as well. It's been studied, and it's really hard to find symptoms that either have a high sensitivity or specificity for immune deficiency. But in general, if it's just colds, just viral infections, that's rarely a sign of immune deficiency.
Okay.
If they have recurrent bacterial infections, that's a little bit more worrisome. Now, it depends a little bit on the child's age, right? So if you have a toddler who has a lot of ear infections, that's kind of normal. But if in addition to that, they've had a couple pneumonias, then that would make me want to test. Or certainly say they're outside the toddler age range and they're still having lots of ear infections, that would cause me to test for immune deficiency as well.
Okay. So are there any other symptoms like problems with growth or their development? Would that be a sign of being related to an immune dysfunction?
It can. About half of kids with immune deficiency don't grow real well. Okay. But there's a lot of reasons to not grow well. So that's not specific for it. But that certainly can be another clue. Some kids with certain kinds of immune deficiencies will have autoimmune problems like low platelets or arthritis or things like that.
So what does that evaluation look like? Who should they bring their concerns to, and then where does it go from there?
I think a general practitioner, pediatrician, family practitioner can do the first line screening. It really, immunoglobulins, which are the antibodies that float around in the bloodstream, and T and B cell levels and a CBC. Really, those are the frontline testing. And if those are all normal, the likelihood of an immune deficiency is very, very low.
Okay. So I think that's reassuring for me to hear about my kids, and hopefully that's reassuring for others, but maybe can shed some light on when they do need to bring them in. Let's just wrap up. I know we talked about this a little bit before, but what Remind people what are things that we can do to prevent infections, and a little bit more about why those immunizations are so important.
Yeah, I think immunizations are the key. They're the biggest thing that a parent can do to keep their child healthy, make sure the child's up to date on their immunizations. Again, immune memory, get exposed to something and they're really not going to get it. And then one of the nice things about immunizations is the herd immunity that we talked about. So we might have patients that are immunocompromised, have had a transplant or have leukemia or something, and they can't get the immunization, but they can be protected if everybody around them has been immunized. So you're kind of protecting your child, and you're kind of protecting the village around your child too. So that I think that's a nice thing.
Absolutely, and that's one of the ways we help protect young infants from influenza too, right? Can you explain the cocooning that we do with infants?
Yeah. So influenza vaccine is not available for kids in the first 6 months of life. And yet those kids are at pretty high risk for, when we talk about the risk factors, one of them is young age. So those kids are at high risk for severe complications with influenza, but they can't get the vaccine. So we just really strongly recommend that everybody in the household gets their influenza vaccine. And that is effective. In fact, a couple different studies have shown if you vaccinate a woman in the third trimester of pregnancy against influenza, the protection of the baby in the first 6 months of life is about 60%. Well, that's about what we're talking about the efficacy of these vaccines are. So it's really important for pregnant and postpartum women to get their influenza vaccine.
Absolutely, and their Tdap too.
And their Tdap
to protect their child from pertussis, because that is also really dangerous in that age group if they were to get exposed.
It really is, yeah. Those are the babies are the ones who really get into trouble with pertussis.
Absolutely. It's not necessarily the older adults. It's bothersome to have a long cough, but it's deadly for little babies.
It can be, yeah.
Yeah. Well, that's all the time we have. Thank you so much for joining us today. Thank you, everyone, for joining us. And join us at the next Ask the Mayo Mom on October 5th at 11 a.m. My guests will be two pediatric pulmonologists, Dr. Julie Bond and Dr. Paul Besch. We'll be discussing problems that you see in the lungs, such as asthma and some more severe disorders that may require some interventions, such as bronchoscopies. Join the conversation by sending questions both before and during the broadcast. And thank you, everyone who joined us today and sent in questions. Have a wonderful day.